Blood disorders. Let's take a look at this video on clots. Because when we are injured, the lining of our blood vessels, they're going to release prothrombin, fibrinogen, and a big tear or lesion is going to be patched. We're not going to bleed to death. And if we look ahead here at the story, we're going to see that this clot becomes a plaque because calcium, platelets, fibrin net are going to save our life. But we pay for that because a thrombosis may form in the blood vessel. So let's look at that. What I'm talking about is, well, let's say someone who's been smoking for 30 years. Little chemicals in cigarette smoke are causing micro lesions in the fragile endothelium of the blood vessel. And so the body's going to form patches like we just saw. And over time, a big thrombosis forms and the channel becomes blocked off. Sometimes a chunk of this will break loose and we call that an embolus. Now we can use the ECG or we can use blood tests, because when this coronary dies, the cardiac muscle downstream is going to die, and it's going to release chemicals that we can detect in a blood test. All right, so it kind of depends on the insurance and the patient's history, what is done. Okay, what I just described was a myocardial infarction of the heart, coronary artery, but it's the same process with a stroke, in this case a carotid artery. We have a thrombosis, they're calling it a plaque, but it's a thrombosis, embolus, and part of the brain is going to die. All right. Also, hemorrhagic stroke may happen as well. Computed tomography is one way we can detect this, but there's other ways as well with high contrast injections. Okay, coagulation is the thickening of blood. I like this picture because we see red blood cells, we see the platelets becoming specialized, and here's calcium. Calcium is going to harden the plaque, which is good because we don't bleed to death, but now that means that clot's going to stay put. I mentioned the word prothrombin and fibrinogen as being forming those fibers. Now, people ask me sometimes, well, does the COVID vaccine cause clots? And I tell them the epidemiology of clots is so complicated. Some people form clots just by being on an airplane and not moving for 18 hours. Okay, some people definitely form clots during COVID because their body overreacted to the invasion and they were clotting, trying to kill the COVID. And so, I mean, their immune system was so revved up that it was causing problems. And anytime we inject something into the body, yeah, okay, it has potential for clots, but I'll leave it at that. Anemia. Okay, that's when you have a few red blood cells compared to what you should have. There's iron deficient type, which is sometimes temporary, such as during a menstrual cycle or if someone has a lot of internal bleeding. But there's pernicious, where we have a problem with, often an autoimmunity of the digestive system. So let's take a look at that. Most have normal absorption. There's a glycoprotein that's produced, and so we can store vitamin B12 and B9 in the liver. Certain genes turn on or off. Whatever the reason, you can't just take more B12 vitamins and fix this problem. It's more serious than that. Hemolytic, okay, there's different types of hemolytic. He means blood, lytic means bursting. And so a blood cell should live about 120 days, but sickle cell is a genetic disorder that can cause bursting of cells. This is a picture of Peter Muga and I. We're working in Kenya. And Peter would get malaria, which is another reason for hemolytic. This organism will burst red blood cells and destroy the liver, fever and chills. And I would ask him sometimes, Peter, Unisikim zodium? And he'd say, no, Nina Mbaya, Nina malaria. He would have malaria, and I would think, well, that would kill me. but he had the genetic trait for kind of a mild sickle cell. So in some places, sickle cell is advantageous, at least in a mild form. Okay, erythroblastosis. I like that word because red blood cell, erythro. Blastosis, indeed, it's going to blast it. This tends to be a problem on the second pregnancy because the first pregnancy, if the mother is Rh negative, she doesn't have the factor, okay? But her baby is positive Rh. How can a baby be positive and the mom is negative? Dad, okay? Dad contributed the genes to the baby, and so that's how you end up with that. The first child is usually born fine because it's expelled during birth before the mother mounts an immune response. The second child is the problem, and that's why a ram shot, which I should have written here, is sometimes used to desensitize our immune system so that the second child is born safely. All right, so don't be surprised if you're Rh negative and you're a female, and during the pregnancy you get an injury. It's really worthwhile. Okay, carbon monoxide. It's an odorless, colorless gas. Our red blood cells prefer it over oxygen. If you get headaches and dizziness, okay, that may not mean carbon monoxide, but if your pets are dying, because CO gas is very heavy, and that's why if you have a carbon monoxide, well, you should have, your carbon monoxide detector should be low. It should be low and between the bedrooms because it can kill. All right, especially if you're sleeping low to the floor. Okay, infectious mono. It's a DNA herpes, and it's an overproduction of lymphocytes, which I have a picture of. Lots of different symptoms: fatigue, fever, sore throat. Sometimes a splurge. It's called a kissing disease sometimes, but it's really not true because we get it when we're young, maybe 7, 8, 9 years old. It attaches to our DNA, and then later, okay, teenagers, their sleep patterns are terrible sometimes. They're not eating well. They're exhausted. Their immune system's dropping off, and the mononucleus virus comes to life. And it just takes time. There's no simple treatment for this one. Yellow fever. I've had my yellow fever vaccine in countries of the tropics, different areas of the world. Yellow fever is very dangerous. I mean, 50% death rates. Jaundice is one of the symptoms. Okay, kind of yellowish skin color. Leukemia. There's different types of leukemia. And what it is basically is there an overproduction of leukocytes or white blood cells. In this, on the right side, just it's often due to something happening in the blood marrow. I mean, cancer is typically the cause, but again, it doesn't have to be super serious. Jaundice is a symptom, all right? We don't really call it a disease. It's a symptom that the liver or gallbladder are not functioning properly because our red blood cells live about 120 days and then they die. Okay. Parts of the red blood cells are not recycled. The bilirubin, it's a pigment. And that's why your feces, okay, no matter what you eat, your feces looks kind of that same yellowish brown color, right, every day. And that's because you're breaking down red blood cells and expelling them. And that's good. But people who have jaundice, it's usually like infants, their liver's not developed yet, or alcoholics who've had cirrhosis. And in that case, what can be serious? Like my son, I just took a big plastic shower curtain and put him out in the sun every day, and that took care of it. The UV rays, so it can be mild. Septicemia kills more people than cancer every year. All right, and especially with MRSA out there. MRSA is a methicillin-resistant Staphylococcus aureus. Okay, long scientific name, scary. It used to be called blood poison. And Streptococcus, another dangerous bacteria It's often in the respiratory tract. And when we have a sore like this, we can't ignore it. All right. Sometimes the tough guys will say, I've had worse. But what's happening is bacteria is flowing into the bloodstream. All right. It's dangerous. We see it in hospitals a lot. People come with advanced toxemia. Beyonce, she had a type of toxemia called preeclampsia during her pregnancy. And that's fairly common because the woman's becoming hypertensive because of the baby. And she'll have some edema or swelling. We'll see proteins in the urine. It can be mild or severe, but it's always worth looking into because kidneys, we can't survive without a kidney. And when we have toxemia, we want to be thinking, preserve those. All right, glucose. To understand insulin resistance, we should understand basically the normal pathway. All right, when we eat something, it's going to move from the bloodstream into our tissues, either into our muscles so that we can move, or we're going to store it as glycogen in the liver. In insulin resistance, for some reason, the receptors are not allowing glucose to be absorbed. So let's take a look at this. In a healthy cell membrane, okay, I know this looks technical, but it's really quite simple. We have receptors. They're going to allow glucose to go into the cell. And if those UT4 receptors are not allowing that, then glucose is going to build up in the bloodstream. All right, and so here we have an example. You can see, I'll stay off of that. Glucose in the blood is supposed to go into the cells. But you see that G bouncing around? That is the story there. Because, and I like this because, this also explains type 2 diabetes. Okay, no matter what you eat, a lot of it is converted into glucose, especially the carbohydrates. And those should go into the cells. All right, and so that's the normal process. Here we have it. That G is going to go through, well, there's gates. Okay, this must be insulin. They're showing us insulin resistance. Now the pancreas is going to help. All right, it's going to produce insulin. Here's the happy story. And that insulin is going to, let's see, we'll take a look here. Insulin is going to attach to the receptors. There, right there. And that is going to open the gates. All right. And that is how it's supposed to work. So this is muscle tissue, the liver. But in the case of insulin resistance or type 2, the insulin's there, but the gates aren't opening because the cells are insulin resistant. And we don't know why it happens. It tends to be tied to genetics, sometimes the pancreas. There's different reasons for it, but certainly obesity is a major cause. All right, so let's avoid that one. Thanks for listening.